Hello, welcome to Inspiration from COVID. Today we have our guest Diego Light, who is the president of Laipac Technology. Hi, Diego.
Hey, Joseph.
Hi.
Hey,
Can you
how are
introduce?
you?
Yeah, very good. So, can you introduce yourself, like about yourself and also your company?
Sure. Yeah, thank you. My name is Diego Lai. I'm CEO of Laipac Technologies in Richmond Hill, Ontario. And Laipac is a company. Um, we design, manufactures IoT devices, which is Internet of Things devices and solutions for wearables, for telehealth and remote patient monitoring.
Okay. So, the COVID-19 hurt everybody. I think most of the business in Ontario, they were uh, 19 hurt your business, and how serious hurting your business?
Well, yes, actually, our company is closed, and by the order, everybody, essential business had to close down the door, and we did the same in March, and so everybody working from home right now.
Okay.
And yeah. So we are Laipac is we are exporter, so we export our product to many countries. Actually, this time is like everybody, right? So it's like a global. So it doesn't matter which area and which country is. It's like a same. Yeah.
Yeah, that's true. So, do you have to lay off your staff or have their working hours reduced?
Oh well, actually, yeah, we have to reduce hours to our people, and some of them, and some of them continue working from home as full hours
Okay.
because our company we design, do a lot of product designs, so we just continue doing those products and new products, new concepts.
Okay, that's good. So, the federal government they push out some of the subsidy program for business, like the CRB or wage subsidy. Does it help your company to like bypassing this difficulty time, or did you apply those programs?
Yes, and for example, I think we still see how to apply that the wage subsidy for 75%, right? Because definitely our business has been affected a lot since January this year. So basically, the revenue just cut more than 50%, right? It's so noticeable, right?
Yeah.
So, but we still want to hire. I mean, I want to have our people to work full time, even though, and so if we get the subsidy 75%, then actually we will try to work, to come back to work full time.
Yeah, that's true. So, some say that this COVID-19 most of the business, but some businesses are growing, like Zoom, the video conferencing company. They see the growth instead of the decline in their sales. But that's why somebody say that if there's a crisis, then. And I know that your company is developing some technology, some solution, helping to conquer the COVID-19. About your solution, or
Sure. Monitoring of the person in location, but also for their health status. So we call the remote patient monitoring and telehealth. So our new solution is basically can collect vital signs from the patient. In this case, could be COVID patients remotely, and so it's like the telehealth is basically the patient doesn't need to come to the hospital, so clinics and is remotely monitored by healthcare professionals, right? So that is a good thing. So still keep the self-isolations, but at the same time, you can care for the patient and at the same time reduce the healthcare resources, right? And at the same time also, just help tell the patient that's infected, or sometimes it's suspect cases to stay home, right?
Okay. Yeah, that's good, because when we watch our PM daily addressing and also the remarks from the chief medical officer, they all talk about the model, the data. It seems that the technology really helps. The data model, right? You can collect the, let's say, patients' data, where they are and their health status. It will help like ease the burden of the hospital, and then it help the medical professionals that how to deal with the situation. So that's I think did you approach our federal government about your solution or what?
We have provincial governments and also federal governments, and besides telehealth, we think about trying to monitor the suspect or COVID patients to enforce the self-quarantine period and to know if the person or patient is staying at home. Our solution can allow that as well. At the same time, we also have electronic bracelet, because our company also we also offer the house arrest electronic bracelet for law enforcement, and the same solution actually can also enforce for some cases which people they don't follow the self-quarantine rules, right? They violate that rule, so we can apply the electronic monitoring bracelet to those people to enforce that.
I see.
And so we have shared with the and I think some of them very it's a lot of interest. We'll see how that goes.
Okay. Electronic bracelet. Just look at Canada. We got more than 20,000 patients, right? So, do you have enough?
It's difficult to have in stock, right? So because we always have to produce the product based on purchase orders.
That's true. Yeah.
And I think everybody does that. So that's what we do. We try to have some stock, and we produce the products here in GTA.
Oh, okay.
So it's Canadian, main Canada product.
I see.
And so still, so again, we will produce, and it's when they have that's really interesting and placing orders, so we will do that.
So when you get the PO, then you can start manufacturing, right? So
we are doing manufacturing at the moment, for our products here.
I see.
Yeah.
So that's better. Then we forget about the shipment. Most of the flight are cancelled, and then the shipment and the freight forwarding could be an issue, right? If you look at those masks and those PPE, it takes a few days, a week to get it from China. So, and that's a priority, the products already. Okay.
Right.
But you say this made in Canada, the plant is in Canada, and it's better. You have some time difference, right? So that's good.
Yeah. Still is local made. We also can control the qualities and I think overall it's good. Everybody is we Canada last year, and we are producing all our products here locally.
Okay.
Yeah, so that's our goal, right?
And you have control, right? So that's important.
Oh no, besides that, I think the most important is we wanted to back to our country and give more opportunity to local industry. And I think we are really
that's good. So okay. And then, as I say, our topic is called Inspiration from COVID-19. Do you have any inspiration to share with us?
Oh yes. I think besides just about business, I think it's personally it's very difficult for many people, and they stay home and isolated, and some people they have family sick, and some people pass away, and this is very very difficult moment for many people. And I just want to say to those and to everyone that's lying there, and this shall be temporary, and this will end, and sooner or later, and then we just need to be strong, courageous, strong and courageous, and then and a lot of faith that this will end, and then and we during this time we just keep our faith up, and don't get too depressed and upset, right? Yeah, that's very important.
So we are all sure that it will go away. It's just in this critical time, how to overcome the financial difficulties, or mentally unhappiness, something like that. So that's the issue right there. Okay.
Right. I think it's a lot of, I don't know. Myself, I'm Christian, so prayers really work, help, and praying, right, have hope, hope, and then right,
united, Spirit is also important, right? You keep positive spirit and positive attitude. So
exactly,
and don't feel panic. I think the government is fighting shorten, okay, not only flatten the curve, also shorten the period, and that's everyone want to see it.
Oh, definitely. Well, everybody working together, and we will be able to cross the curve. We will be able to end the war much earlier.
Okay, good. All right. Okay, Diego, thanks for talking to us, and then we hope and then help conquer the virus. Okay, so keep in touch. Good health. Safe and healthy.
All Thank you, Joseph. You take care, and everybody take care
you
out
too.
there.
Thank you.
God
Bye.
Bless.
Take care.
God bless. Thank you. Bye.